If you suffer from sciatic pain and nothing seems to be working, you might be treating the wrong problem. Today, I'm going to reveal the #1 hidden cause that a lot of people don't know about, but it's scientific in the way that you can address it. This is a fix that anyone can do from home. Doesn't require any equipment and is successful at reducing sciatic nerve compression for most people. And as a bonus, at the end, I'm also going to share additional techniques that you can use for instant pain relief, which you're not going to want to miss. What is sciatica? Why is it so common? The sciatic nerve is the longest nerve in the body, as wide as your thumb at certain points. It runs from your lower back. Several nerve endings come together. It goes down through your buttocks, down your legs, controls all the muscles, sensations in your legs, all the way to your toes. When it's compressed or damaged, there can be a sharp burning or aching pain, or there can be numbness and tingling. It can be mild or it can be extreme. I've seen all cases. Pain can be super severe. It can disrupt sleep. It can disrupt work, all aspects of your daily life. In worst cases, it can cause weakness, even bladder control issues, because this is the biggest warning sign with pain, is that those nerves don't just go to muscles and sensation and cause pain. They also are the same nerves that go to the organs like the bladder or reproductive system. So that's why we need to get to the cause. Sciatic pain for ages 30 to 50, that's likely due to a bulging or herniated disc from lots of poor lifting or repetitive bending, sedentary lifestyle, obesity, pregnancy, or just too much sitting. Sitting is the new smoking, and this is one of the big reasons. If you're over the age of 50, it's more than likely spinal degeneration. The discs and the cushions in between the vertebrae are wearing down like tires wearing out on a car. You lose the disc space, and it results in the nerve, the opening closes, the nerve gets compressed. But that's not all. There's also another hidden cause of sciatic pain that a lot of people don't know about, and it could hold the key to you finally getting relief. You see, it's not just damage to your spine that can cause pain. Anything that applies pressure to the sciatic nerve can create this pain. And one common culprit is called the piriformis muscle. Piriformis is a pear-shaped muscle from the tailbone to the hip. It stabilizes your hip, rotates your leg outward. The sciatic nerve is really close to it, and for some, the nerve passes right through the muscle. So when the piriformis is tight or spasming or inflamed, there is direct compression on the nerve that creates the pain or the numbness or the tingling. Now, this can be caused by both overuse of the hip joint itself, bending, lifting, or prolonged sitting. You are constantly in an activated state when you are sitting. This is why sitting is the new smoking. It's really hard on your piriformis muscles. Really common for older or retired people, and it's one of the reasons I tell all my patients to stop sitting on their wallets. Men, when you sit down, if you have that 2-inch, 1-inch wedge behind your right or left cheek, pull that thing out, put it in your front pocket when you sit down. The #1 things I taught people in the clinic to start doing to take care of the balance of their pelvis, and especially their low back pain: don't put your phone back there. Don't have anything in the back pockets when you sit down. Take it out when you sit. Now, here's how to know if the piriformis causes the sciatic pain that you're experiencing. If it's concentrated just to the buttock area and the hip area, kind of the outside hip, real tender, or right in the glute area, if it worsens the longer you sit, or if it worsens when you activate the hip, such as going up the stairs, if it's triggered by hip movements like externally rotating your leg, or if it's real tender, right, you can go ahead and check it right on the bone you sit on when you apply pressure. That's how you know. So let's get to some relief. Most sciatic pain is due to a disc bulge or a herniation, not the piriformis. That's the ultimate root cause. However, clinical trials show that 80% of cases with sciatic pain improved when they took care of their piriformis. So 80% improvement. Let's dive into how to take care of this thing. There's multiple layers. #1, seated figure 4 stretch. Lay on your back, cross one ankle over the opposite knee, and then pull that knee or that ankle towards your chest. You'll feel the stretch directly in the hip and the piriformis. Hold there for 10 seconds and repeat 3 to 5 times. It can be done multiple times a day on either leg, or focus just on the impacted side. All right, if you did feel the stretch on that one, then try this next one. And even if you did feel the stretch, this is another great one for it. This is knee to shoulder stretch. Lie down again, pull your knee towards your chest, and then bring it across slightly to your opposite shoulder and hold. In this position right here, you're going to stay for 10 seconds. You're pulling on the knee. You're going to feel the stretch directly in the hip, right on the piriformis. If you want to make it a bit more challenging, extend your foot for a pull into the hamstrings connecting to the piriformis. You're going to do this 3 to 5 times. Can be done on both sides or just focus and isolated on the impacted leg. Okay, what if these stretches don't work? Your piriformis likely needs to be strengthened instead of stretched. So here's a quick test. You can cross the leg while you're sitting over your knee, your ankle on top of your knee, and then push that knee down. Mine's kind of tight on the right side. I can feel it right in that hip buttock area. Now I'm going to go to the other side, cross the ankle over, and give that knee, I'm holding onto the ankle, I'm pushing down on the knee. That one doesn't have as much in it. And so if you can push both down and you're really not feeling much, then you likely need to strengthen instead of stretch the piriformis. So try these exercises. The first one is the clam shell exercise. You're going to lie on your side. Knees are bent, but your feet are together. You will open the knees, keeping the feet touching, and then bring back together. You're going to do 3 sets of 30 reps. Those can be done on either side or just on the impacted side. Number 2 is the glute bridge. I love these. You lie on your back, knees are bent, feet are flat. You could use a band if you wanted to challenge yourself a bit around your knees to bring your knees together a little bit more, but it's not required. You are going to lift your bum and your hips off the ground, squeeze the glutes together, hold for 1 to 3 seconds, and then bring the pelvis back down to the floor, and then go again. You're going to do 30 1 to 3 second holds. If no relief, you're not feeling a little bit of burning going on in there, the pain might be disc related. So let's test if it is. First is the Sphinx stretch, also known as Cobra. You're going to lie face down, prop up your upper body onto your elbows, and stay there. Now, at first, the pain might initially worsen just a touch, but if it then improves, it is likely disc related as you're taking pressure off the disc in this position. It's actually a good relief exercise if you do have a very acute inflamed disc to be in this position to try to get some relief. If your sciatic pain is disc related, which oftentimes they are, another way to quickly relieve the pain and help from it getting worse long-term are spinal molding rolls. Now, these can go underneath your lower back. They support the spine. They reduce pressure on the discs themselves, takes pressure off of that sciatic nerve. These are really good for helping to mold the curves in your spine. When you look at your spine from the side, you have a curve in the neck, a curve in the mid back, and a curve in the low back. The neck one is 45 degrees. The low back is 35. When we sit all day or bend and lift all day, we take those curves out and we create a loss of curvature. So just like retainers help to keep teeth straight, these can help keep your spine curved in the right position they're supposed to be. Bridges and dams are built out of arcs. So when you have the proper disbursement of force all day long, less pressure on your disc, less pressure on your nerves. So these spinal molding rolls can be used in the evenings. Now, the lower back has a 35-degree curve, so little is for low. It's a 2-inch foam roll. In the neck, it's a 3-inch, and these aren't your foam rollers you're using in the gym. They have some give to them, almost like a pillow, and they put the curve into the spine while sleeping. Now, the first time you do this, you might only be able to go 20 minutes, but you'll work your way up to several hours every evening, and you're at least giving your body some reinforcement to go back to normal from maybe the daily activities that you did that took and damaged the spine, like sitting or lifting. Now, the cool part about these spinal molding rolls is that they can double up, and you can put it on your car seat if you drive a lot, or on your work desk, and it's going to be placed right into the small of your low back, and it helps you to put a curve into your spine while sitting to prevent the damage that's creating a tight piriformis and an irritated sciatic nerve in the first place. I custom formulated these to fit the perfect size of the spine. The link for those is below if you want to check them out. Both of those, the Sphinx stretch and the spinal molding rolls, should help give you some instant pain relief and also help long-term with preventing further damage. So sciatica and damage to it is not permanent for most. That's the good news. The key is to find activities that help it and then stick to them. These need to be done regularly. A lot of people think that rest is just the only way to feel better, but a lot of times I find inactivity can actually make it worse. So we need to keep the body moving. We don't want to hurt it, but these stretches are a great way to put motion into that spine so it can heal. Let me know below which one of the three worked the best for you. Was it the stretching? Was it the strengthening? Or was it the disc exercises? And to stop creating so much damage, check out the exercises that I think everyone over the age of 50 should completely stop doing. I've even stopped doing them in my 40s. Check out this video right here.